Dr. Rashmi Hegde worked as medical officer in Primary Health Center, Haldipur, Honavar for 1 year, worked as junior resident in the Department of Anaesthesia, MMCRI, Mysore for 3 years, worked as consultant anesthesiologist at Nanjappa Super Specialty Hospital, Shivamogga for 2 years, working at Bhagavat Hospital, Sagar, Shivamogga as consultant anesthesiologist since 3 years. Conferences and CMEs attended 10. Over to you, madam.
Thank you, sir, for the introduction. Respected chairpersons, dear colleagues and my dear friends. Today I will be talking about acquiring necessary skill sets for private anesthesia practice. During our post-graduation, we acquire some skills regarding our knowledge, learning, experience and ability, which improves our competence. But there are some skills which are lacking, that is personal skill and people skills. We will mainly concentrate on this because when we acquire all these skills along with the technical skills, we will be successful in a private practice. Coming to private practice, there are different types. We might be working at a corporate hospital and attached to a specific small hospital or our own nursing homes, or we might be freelancing. All these three scenarios have their own challenges, but adaptability is the key. Because for one case, we might be in a hospital where there is only boil separators, only basic monitors available. For a next case, you will be in a hospital with advanced workstation or advanced gadgets. So we have to adapt to different type of setups, different surgeons and even different people. Good communication is required because we are judged by the way how we speak and we communicate with others. We have to communicate with even surgeons and the OT staff and even with the patients and patients' relatives also. So our communication should be clear, correct, complete, should be concrete, concise, coherent and it should be courteous. So when we incorporate all these 7 C's of communication, we can gain the confidence of even surgeon and the patient. So proper communication is the key. Stick to your own protocols, like adequately prepare the patient and check NPO status, diabetes and hypertension control and all about medications. Why is this relevant? Because as sir told, in periphery usually surgeons will, he would have shifted already the patient to the table and then he will call us. So that time we will see a very high BP on table. It's very difficult to convince the patient or to cancel the case also. So it is very difficult. That's why we should always tell the surgeon not to shift without PAE. You ask proper history, examine, auscultate the patient, get all basic investigations, don't compromise in that, and avoid unnecessary investigation. Only specific to that case you can ask the investigation. And it is very important to explain the consent also. In private hospitals, case cancel ratio should be minimum because one case lost is equal to revenue and reputation lost for the hospital. So if you frequently cancel the case in corporate hospitals, hospital administrator will call you to the chamber and he will ask about that. And if you are freelancing, surgeon will think whether to call you or not. Private hospitals love anesthetists who are confident, punctual and available all the time. So we should be confident when we are giving anesthesia also, or when we speak with a surgeon or the patient. Don't show your nervousness. Be on time because no surgeon like to wait for an anesthesiologist. And you should be available not only for all the cases, even any post-op complication you should attend immediately. It is important to learn when and how to say no to surgeon without hurting surgeon's ego. Because there are some situations where we have to refer some high-risk cases, especially when there are limitations. We should have our own clear cut-off value to refer. Like in my practice, I usually don't give anesthesia for less than 2-year-old child alone because I feel it is difficult. I should have one more helping and or backup anesthetist, which is not possible. And I refer some high cardiac risk cases because there is no cardiologist or no even cardiac ICU available. But usually surgeon will put pressure on us to give the case. and he will only decide sometimes which type of anesthesia to give also. But we should not listen to them. We should take our own decision, because it is always better to be safe than the sorry. Now, I want to share one of my experience. I had a case for spine surgery. He was very well built and nourished person. I gave a scoling and even with extra propofol, also with 2-3 attempts, even I couldn't even pass a bougie. So I told even I cannot give a vecuronium, so I am not going to proceed with the case. But surgeon was pressurizing me to give repeat the scoling and you try once again. But I firmly decided. I told I will explain the patient's relative. I maintained, explained, and I referred to a higher center where there are 2-3 anesthetists available, and the same surgeon operates there also. So next day surgeon called me and told, "Madam, you took a very good decision. It was very difficult, and somehow with 2-3 attempts they could intubate finally." So always it is difficult intubation will be a difficult extubation also. So you should think whether to proceed with the case or not. Don't comment about any surgeon or your anesthesia colleagues, because we are working with a different department and even different surgeons. So you should not tell any negative things also. Don't appreciate one surgeon in front of other. Then only you are liked by many.
Liked by all.
Yeah, liked by all. You should be multitasking because we should adjust even in all hospitals will not have a sufficient staff. So we should adjust the light. Should not hesitate to tie gown or show CM. Should know about even cautery, suction, tourniquet, how it works, and all the connecting points like laparoscopy, endoscope equipments and all, and even about sterilization, autoclave video. Don't hesitate to multitask. Learn to manage with less equipment, but you should ask the hospital administrator for some basic equipments like monitors, anesthesia workstation, defibrillators, emergency drugs and all. It is very better to have your own difficult airway kit and carry your own emergency kit, because there are some nursing homes, there will be a laryngoscope but the batteries won't be working. So we should have our own kit. So don't hesitate to spend for all those, because there are some equipments we must have and some like good to have, like you can ask for ultrasound or video laryngoscopes, all those in a corporate hospitals. Technical skills, this usually comes with our experience, but it is very important to be well versed with even basic skills, because even we should know, always will not get ultrasound in all hospitals, so we should know even landmark guided technique also. We can carry our own nerve stimulator so that our work will only become easy. Being up to date is very important, because it is a competitive world. Even in town, anesthesiologists are increasing. So to get recognized, we should know some extra things like labor analgesia, pain management, ICU care and all, and try to learn through workshops, short courses, through videos and some online lectures and all, and keep record of the cases like difficult or high risk cases which you have done, and try to publish those. Leadership skill is very important, because we are supposed to be a team leader of OT, ICU, casualty or trauma. So even we should manage a OT technicians, scrub nurse, even group D workers in the OT and even OT students. Leaders are made, not born. So leadership skills should be learned. For that we should be emotionally stable. Like we should not get confused easily or become angry easily. We should make a quick decision. Problem solving property should be there. Coach your team and be focused throughout the surgery. And it is very important to be there with the patient till the end of the surgery. And you should know how to delegate the work to your team. So to become a good leader, first you be, then you do, and then you see, and then you tell others. Even teaching or training skill is required even in a private hospital, because there is a high attrition rate and the staff will keep on changing. There will not be sufficient trained staff or assistants always. So you should train a new staff. Especially during this COVID time, there were OT technicians used to come. They had got the certificate even without entering the OT only. So they used to come and join. We had to teach them everything. So we should have a teaching skill. We should build a team of trustworthy people. Maintain good friendship companionship with your colleagues, because 1 plus 1 is not 2. It is equal to 11 in difficult cases. So any emergency, call for help, call your colleagues in difficult cases, and even help your colleagues when they call, because you may face the same situation in the future. So you give respect and take respect. Coming to recognition, every anesthesiologist has an identity crisis, but we can get recognized by doing pre-op rounds and post-op rounds. You introduce yourself by your name and you tell I am an anesthesia doctor and what you are going to do. And so that you build a good rapport with the patient so that he remembers you, and attend IMA or ISA activities and attend social function. Let people know who you are. Yesterday I was coming by auto. The auto driver asked me, "Are you a doctor?" Yes, so I am an anesthesia doctor, I told. And I thought he did not understand. I told all surgeries need anesthesia. He told, "I know that, but is there a separate specialty for anesthesia? I thought surgeon will only give anesthesia and he will operate." This is the situation in our places. Stress management is required for every doctor, because we should take care of our health by regular exercise, balanced diet, do meditation, do mindfulness activity, have your own health insurance, because since we are on a 24 hours call, we should adjust to a long working hours. So give a quality time for family, don't compromise your family, take off vacation, and in the periphery when you are not there, it is very important to arrange somebody for the hospital also. So plan a schedule for even a self-learning to attend conferences, CME and all. Professional indemnity we must have, because the initial days of practice we think we will earn for some time and then we will take. It's not like that. We should always, at the beginning of the practice only, we should always have one from ISA, and it is better to have one more from even private insurance company, because anesthesia is a very high risk profession and all our risks should be protected. Unity among anesthesiology in a city or town should be there, because you should fix some minimum charges. If one person goes for a less payment, then it becomes a very bad competition in that area. So we should fix minimum charges for some cases, and extra payment should be based on the time taken for the surgery, complexity of the surgery, and even risk profile of the patient. So in corporate hospitals, there will be insurance patients in some hospitals. That fund will not get released soon. It will get like only after 1 or 2 years you will get. So by the time we would have joined somewhere else. But it is, we should keep on asking for that, because we should get paid for our expertises and services. So summarizing everything, for a good private practice, we should be adaptable, have a good communication skills, stick to your own protocol, be confident, punctual and available, and you should learn to say no to surgeon, and don't comment on others, and you should be multitasking and learn to manage with the limited equipment. You should develop good technical skills, leadership skills, teaching or training skills, have a urge to stay up to date, maintain good friendship with your colleagues, and manage your stress, have a professional indemnity, and you should have a unity among anesthesiologists for fixing the charges. I thank my teachers and organizing committee for giving me this wonderful opportunity. Thank you everyone. Thank you.
Thank you, madam.